Thank you, ma'am, for all those kind words, and thank you, Bansi sir, for this opportunity and getting IPN into this forum of diabetes and obesity being, one of the most metabolic diseases where nutrition has a prominent role to play. So I am going to talk about regarding the protein efficacy in the management of metabolic diseases. Quite interesting things what I came across while making this presentation. Just to begin with some numbers over here. So worldwide what we see around 700 million obese people and 537 diabetes people, that is almost 10% of the global population in the year of 2023. Definitely it may be increased by at least 2 to 3% by this year. And the four major conditions what we actually come across is obesity, diabetes and cardiovascular diseases and non-alcoholic fatty liver diseases as well. Definitely all these diseases also has a direct relation with what we eat and how we metabolize. And let us see what protein has to do it over here, and because we are all protein deficient population, and even those non-vegetarians who will be feeling that I'm a non-vegetarian and I adequately I consume proteins, sorry to say that it's not like that. The difference between the vegetarian and non-vegetarian of Indians is just the decimal of 0.1 to 0.2 grams of difference between them. The reason because you're not non-vegetarian on all the days, you're non-vegetarian on only on some specific days, maybe Wednesdays, Sundays, something like that. So we should not be overboarding ourselves saying that because I'm a non-vegetarian, my protein adequacy should not be being challenged and I do consume adequate amount of protein. No, it's not like that. There are many meta-analyses which demonstrate that high protein diet significantly reduces the fat mass and retains the fat-free mass. Yes, this is nowhere being challenged and very well accepted, and there is no dearth of evidence for this to prove for that one. What we need to understand regarding the protein role in increasing the satiety hormones, that is the GLP-1 and the cholecystokinin and the peptide YY. How do these three hormones have a role over there? And the ghrelin thing, it has been seen the higher the protein we consume, the ghrelin release is being reduced and the leptin is being increased. So that's one thing what we need to really understand, how we are going to benefit if we are going to increase the protein content in your diet. The metabolic advantages, which will be definitely I'll be explaining in the next few slides. The elevated diet induced thermogenesis. The protein actually consumes more energy, that is a thermogenetic energy, the energy what we spend for metabolizing the nutrients. The protein actually absorbs a lot of energy over there. In a way, if you are consuming say around 40 to 50, I'm talking about, I'm not exact figures I don't have. So I'm just putting it across in a metaphor way. Say for example, if you're consuming 50 grams of protein, the body may be spending around 150 to 200 calories to metabolize those 50 grams of protein. So it means that you're spending more energy to metabolize those proteins. So if you're increasing protein content, unknowingly or knowingly, you're spending more energy over there to see that those proteins are being metabolized and being used by the body. And maintains resting energy expenditure and supports sustained long-term weight loss as well. So gist of the previous slide, that is GLP-1, CCK and peptide YY, how do they function? They enhance insulin secretions, reduce appetite and slows gastric emptying, that is the GLP-1. And cholecystokinase, yes, stimulates digestion and promotes satiety, and reduces peptide, reduces appetite and slows gastric emptying. So the impact on the metabolic is, there is an improvement in the glycemic control, it promotes weight loss, and type 2 diabetes is being well maintained and obesity is being taken care of. It helps in reducing the food intake, supports fat digestion and helps suppress appetite and control obesity. Looks like a really very good package when you are consuming a good amount of proteins as well. While making this presentation, certain kind of, as I did mention in the beginning, that certain surprising things what I came across was the whey protein, the way it is going to function, and the soya protein, how it is going to function in your system when it comes to the metabolic diseases. As whey protein and soya protein, for the general, the ones who are not nutrition experts, I would like to say, they are complete proteins. They have all the essential amino acids required by the body. So no way they are deficient from each other when it comes to the amino acid profiling. But the role, if you see over here, whey and soy, there's a little bit of surprise element which comes to understanding over here. What we need to understand, ACE is the one which actually converts angiotensin 1 to angiotensin 2. This angiotensin 2 is the one which actually constricts the blood vessels, and that is how the blood pressure does increase. And whey protein is the one which actually prevents ACE being converting angiotensin 1 to angiotensin 2. So that is how we see there is a dilation of the blood vessels, so your blood pressure is well maintained. So getting a whey protein into a diet is something like someone who is suffering from hypertension. This is a really a really good guideline for you all to include whey protein in your daily diet. When it comes to soy protein, again, what you can see it over here is like soy protein is a bunch of many nutrients, just not the essential amino acids. Along with the essential amino acids, it does provide isoflavones, it provides plant steroids, that is the phytosteroids, and it has a good amount of soluble fibers as well. And these isoflavones which acts like the estrogens, and one thing what we need to understand, these liver, to the dietetic fraternity I would say, liver has these receptors are the LDL receptors, and these receptors in the stress time, they are non-functional, or I would say कि they go lethargic kind of a thing. They are less functional, I would say. To make them more functional, these receptors, we need to get these elements in together as a bunch of it. It's just not the essential amino acids, even the isoflavones or the phytosterols and the soluble fibers. When they are taken together, they are activating these receptors, and LDL is being absorbed from the circulation, and that's how what you can see, the circulatory LDL is being reduced. And also the added benefits of genistein and diazine, which are the isoflavones. They act as antioxidants with weak estrogen properties, and they improve the lipid metabolism. Further, soluble fibers, they have again added features to that one. These proteins and the fibers, they bind the bile acids and they are excreted, and liver uses more cholesterol to make bile acids. That's how LDL is being better utilized rather than being sent into the circulation. If they are more into the circulation, definitely they are going to have some issues with the cardiac functioning. So some studies suggest that they improve endothelial functions and reduce LDL oxidation, making LDL less atherogenic. So these are the benefits of including soy protein in your diet. However, there are no recommendations how much exactly the soy protein or whichever the protein is required. I came across this one FDA recommendations. They do recommend that 25 grams of soy protein on a daily basis should be included in your diet, so to see that the LDL is being lowered into your circulations. This is one more study quite interesting regarding the glycemic control, but various kind of benefits what has been shown into this study was like the protein effect, the whey protein. There are three arms which in this study were considered. One is a square one, what you see, the first one is where no whey was given. The second one is a circular one where the whey in the meal was mixed, and the third with the dotted, the dark black dots, what you can see is the one which whey preloaded. Like before the meal, they have been given a whey protein. After that meal, after few minutes, they were asked to consume the normal meal, which doesn't has whey mixed. So we have three without whey, the second one whey mixed with the meal, and the third one whey preloaded. And what you can see it over here, is the one which the gastric emptying time with the whey preload is taking a lot of time over there, and the one which no whey is being emptied faster. At the same time, the concentration of the blood sugars, what you see with the whey preload, we have a more flatter kind of a thing. Maybe the spike is not that really sharp compared to the ones which are without the whey. When it comes to the plasma insulin, again, what you can see that there is a really good release of plasma insulin to maintain the blood sugar which is being rising after the postprandial, and the plasma GLP-1 is also keeping a tandem with the increase in the insulin. So that's how the blood sugar is being well maintained when you are having good amount of protein before the meal. Also, the benefits what is being explained in the plasma GIP. GIP is the one which is going to instigate the pancreas to increase the insulin. So of course they will look similar in their spikes, what you can see, not spikes I would say, the way they are being released into the circulation. That's how the sugar is being well maintained. If you see the black dots compared to the square ones or the round hollow ones. And even the plasma CCK, as you say, the release is being sustained for a longer period of time, so that it shows that the gastric emptying is also being slowed. That's how the blood sugars release into the circulation is being quite slow, and you won't see a spike over there. When it comes to certain kind of amino acids as well, I knew regarding the methionine role into the cancer, because I come from a cancer nutrition background basically. But regarding the metabolic activities and how do these this methionine has some kind of a role in metabolic activities was really again surprising while making this presentation. Methionine is a essential amino acid, and it comes into the whole profile. If it's a complete protein, you will be getting it in all the first class proteins. If you can restrict methionine from the diet, what are the benefits? What has been observed in some of the studies? They improve the glucose utilization, and they reduce the oxidative stress. They improve the lipid metabolism, and they extend the lifespan or the health span. That is the healthy aging you can say about. So these are the benefits which are explained in this slide, how a methionine restricted diet can improve the metabolic health over here. So what you can see that there's an impaired energy regulation in diabetes or obesity. The energy is being excessively available, but it is not being properly utilized. Once there is a methionine restricted diet is being implemented, there is an enhanced energy expenditure where fat oxidation and it reduces the cellular stress. So how does it happens? Like methionine restriction activates the AMPK pathways. These AMPK pathway is it's energy sensitive. If the more it is being active, the more energy it is going to be produced. And even when it is not required, if more energy is being produced, definitely it is going to be deposited somewhere, either into the liver or into the adipose tissues. Then you have this FGF2 hormone is also being released in excess and promotes energy expenditure and fat oxidation. Then it modulates the mTOR pathway. mTOR is the one which actually regulates how protein and carbohydrates are being utilized. It is something like a kind of a tap where we need how much of water you need, you are going to leave it. When you want to stop it, you can stop it. Similarly, mTOR acts like a stoppage over there. When you are sleeping, not excess energy production is required, so mTOR will be quite active over there. Not much excess energy will be produced. But when your metabolism has gone for a toss, it is not going to realize when to stop or when to reduce the energy production when it is not required. We understand that if I'm talking, I'm spending more energy. If you're listening to me, you're comparatively spending less energy. But when mTOR is going wrong, it is not the same with us. So it is something like it doesn't know where to reduce, it doesn't know where to stop, and it doesn't know where to slow down. So this is happening with even in the cancer and in the metabolic disease. However, even cancer is also known as a metabolic disease as well because of the sugar metabolism. And then there is a potential as adjunct therapy in obesity and diabetes and cardiovascular diseases. The research is still going on. Whatever the research has been conducted is into the animal studies. We are just waiting for the human studies to come out with the strong recommendation for the methionine restricted diets. However, it's quite interesting. Maybe in the coming few years, we will have a definite answer for this one. To summarize regarding the methionine restriction, it improves insulin sensitivity, better glucose control, reduced diabetes risk, reduced oxidative stress, less tissue damage, improved metabolic function, improved lipid metabolism and lowered cholesterol, reduced fatty liver, longevity effects, and potential delay in age-related metabolic diseases. Looks like really a very remarkable kind of intervention. I don't want to spend time over here. Muscle mass, we do understand good amount of proteins preserves your muscle mass, and yes, we have less fat mass as well. Just to finish it off, to save some time, what I spoke is just a summary of that. We need to personalize whatever the recommendations what we are going to give, whether it's a carbohydrate restriction or a methionine restricted diet or maybe calorie restriction diet or a just increased protein or protein supplementation. It cannot be generalized, it has to be personalized, and that is how we need to be taking the message from this presentation. So we do understand protein supplementation has a lot of role to play in the metabolic diseases, just not maintaining the weight. Even the pathways also can be regulated in the best possible way where we can really avoid the complications. Thank you so much. Yeah.